Welcome back. You're watching Inside Politics. Thank you for staying with us. Remember, you can interact with us via social media at KTN News KE. The hashtag to use is Inside Politics for easier tracking of your tweets, of course. Now, before we took the short break, the issue of gender representation was the topical discussion right here. Rosaline Obala, I'd love to hear what you have to say in response to the utterances by Mark Bichachi earlier on.
Thank you, Jesse. Maybe just to clarify on what Mark had said, if you look at the current parliament and if you take the scenario of the elections in the current parliament, in the National Assembly we have 349 members. Of these, only 76 are women. That one is if you exclude the 47 affirmative action seats, which translates to 21%. Now, if you go to the Senate, we have 21 women, of which only 3 were elected. The others are nominated, translating to 30%. So when we talk about the representation of women, you find that even with the affirmative action slots, we are not still able to meet the gender parity. Now, when it comes to the allocation and funding of women, in the BBI, we have actually entrenched CDF, and we have entrenched the ward fund. So when you talk about MPs not being able to handle funds, it is not true. Now, in the National Assembly is where we appropriate the funds, and that is why the division of revenue is actually introduced in the National Assembly. And that is why the women representatives were given the 2 billion affirmative action fund, where they're supposed to use 7 million in every constituency. Now, when you come to the Senate, the function of the Senate is to look at the interests of counties and protect the interests. It's not about the appropriation of funds, and that is why the county allocation of revenue fund is being introduced in the Senate, because it is a vertical allocation of funds to the 47 counties. So it has nothing to do with appropriation of funds, and that is why even the push by the senators to have the oversight affairs fund has not been sailing through, because we don't have a provision on how to appropriate funds in the Senate. So that is why when you take the 47 women to the Senate, then you deny them that capacity to be able to initiate projects and protect women within the counties.
All right. Mark Bichachi, I can see you shaking your head. Quick response, kindly.
Number one, my statement was, I never said that MPs are unable to handle funds. I said it's not their primary goal. If you look at the definition of what a legislature is supposed to do, they are focused on the role of creating laws and policies that are supposed to help society. So let me put it in perspective. To say that if you put 47 women in Senate, notwithstanding that Rosaline is totally ignoring the argument that Parliament is now required to meet the 2/3 gender rule, so there will be women in Parliament more significantly than they are today within that National Assembly. She is totally ignoring the fact that sitting in Senate and supervising the use of funds that are used to make sure there's early childhood education, that there's proper health care, and that there's proper usage of county funds, and then to disassociate that amount of responsibility and how it impacts women is not true. It's a logical fallacy, because supervising those funds, ensuring that governors are ensuring that the environment around healthcare, early childhood education, agriculture, and the other things that directly affect women is to disenfranchise women is not true. Also, putting 47 women in Senate does not then preclude how many women will be voted in and how many women will be nominated to make sure that the 2/3 gender rule is met. So there is nothing women are losing in as far as that particular legislation is concerned. And that's my bone of contention. We're acting as though women are losing, as though Senate is some important house that does nothing, yet they serve a very important role in the functioning of our counties.
All right. I think we'd rather leave it right there so we can actually take a look at the state of healthcare in the country. I'd also like to appreciate the presence of Hesbon Owila, who has just joined us. We'll definitely get to interact with him after this story, where the Ministry of Health is hopeful that Kenyan scientists, in partnership with the AstraZeneca, a pharmaceutical company, will bring out an effective vaccine for COVID-19. Now, according to the CAS, Dr. Masi Mwangangi, 400 Kenyans have so far registered for the vaccine trial that is underway, and the ministry hopes to get 60,000 participants. This comes at a time when COVID-19 infections have been rising since October. Here's that report.
We are going to have discussions with AstraZeneca here to see how we can ensure that Kenya is first in line, because only about 8 countries are participating in this trial, and Kenya is the second in Africa after South Africa. So there are discussions to see how will Kenya benefit from taking part in such a trial.
This discussion comes at a time when the country has been recording a positivity rate of between 14% to 20%. According to Mwangangi, Kemri team in Kilifi County is reporting positive results of the vaccine. The CAS has also emphasized that the ministry has not neglected health workers, a point strongly disputed by health unions' representatives.
You cannot talk about building bridges and then not building bridges with the health workforce in this country. If this sector is not important, then tell us once and for all, but don't take us round in circles.
In Kakamega County, health workers have issued a separate strike notice effective from 9th December, arguing that the county government has failed to protect them as the frontline soldiers despite them handling COVID-19 patients.
We are going to die because we are serving the public. We are on the front line. We are soldiers. Tumepewa bunduki tuwe mbele, ili we receive the bullet on behalf of the public. Tutawacha familia zetu tukifa because of corona.
More than 30 health workers have now succumbed to the virus, with the major reasons raised by the union being lack of personal protective equipment. Countrywide, the effects have started taking place as health services have been paralyzed in counties like West Pokot. Meanwhile, 727 new COVID-19 infections have been recorded out of a sample size of 4,913. This brings the total COVID-19 infections in the country to 78,512.
806 patients have recovered from the disease, 701 from the home-based care program, while 105 have been discharged from various hospitals. And so total recoveries stand at 52,709.
The number of the dead over the last 24 hours is 17, raising the death toll to 1,409. Sada Hassan, KTN News.
Just to note, those numbers by my colleague Sada Hassan on the latest COVID-19 numbers are not the latest. So just a disclaimer right there. But what's factual is the state of medical doctors and health practitioners in the country. KMPDU issued a strike notice. We've seen a couple of counties also break down in terms of healthcare services in the counties, Elgeyo Marakwet being one of them, and just as she's mentioned, Kakamega County have issued a strike notice. Hesbon Owila, many thanks for your time right here on Inside Politics. I'd like to begin with you. What is the state right now? Is there any progress? We've seen the health committees in Parliament actually meet with representatives. Would you term this as progress in any way?
I think there is progress. When conversations are going on in light of the strike notice by the medical doctors and practitioners, then you know that those are conversations that are geared towards finding a situation that would sort the problems that medics have, and of course address the key challenge that we have today, which is COVID-19. And I'm also sure that Kenyans need to worry. If we believe in the leaders that we elected, all we need to do is call upon our leaders, especially our members of parliament, and put an eye on what our county governments are doing. Because as you know, health is a devolved function, and there are a number of questions that have been raised in terms of what have these county governments been doing in as far as taking care of the medical practitioners, doctors, health workers, is concerned, and providing the necessary facilities first for the patients, and secondly to ensure that doctors have the PPEs. So those conversations are essentially what we need to hear, but then conversations cannot go on forever. We probably want that reassurance that things are gonna get back to normalcy, and we won't be hearing our doctors and medical health practitioners complaining. But I would want to tell you that sometimes I think some of these things are just too escalated for purposes of diverting attention and focusing people to non-public, health facilities. And the reason is very clear, that people would want to channel more of COVID cases or just their resources as far as medical attention is concerned to the private sector. And there is a sense in which that then may mean that a few of the elements will start bastardizing the public health sector. So there's a lot that needs to be done, but we also need to be wary of people who are just calling attention on issues that are neither here nor there, so that we lose that trust in the public health system. I think all of us have been affected by COVID, and we know for a fact that the systems that the government put in place in terms of contact tracing and all that have worked. So all these issues are issues that are behind what a normal Kenyan who seeks medical health is concerned. And it's incumbent upon the practitioners and the ministry and all the parties involved to solve this. But then I would also want to say that, some of these hopes that you're giving Kenyans, vaccine, it might take a while. It might actually take a while. And I think today what we need to be preaching is that the best way to go about this are non-pharmaceutical, protocols. Just wear a mask, socially distance, and wash your hands. And we will definitely be speaking the language that will help mitigate the spread of COVID-19 and cushion our health infrastructure from a lot of strain.
All right. Dismas Makua, I mean, what the KMPDU actually mentioned right there, the representative, we can't be building bridges without the medical practitioners. They're in distress, and it's quite evident if the strike notice is anything to go by. Where did we go wrong? Because in the midst of a pandemic, having a strike notice and some medical workers actually substantiating the strike notice is worrying, don't you think?
Well, maybe we look at it from some of the successes, the failures, challenges, and the key actors. Long before COVID, we had every county governor, 47 of them, every single day they were launching a hospital, referring to them as, level 1, level 2, level 5, referring to them as referral hospitals. Now, when COVID comes in, the governors have been exposed. Because how do you have a referral hospital if the basic understanding of English is accurate, that has no capacity for ICU, that has no capacity for HDU, that has no capacity for infectious diseases? So it seems to me that the governors have been all sizzle and no steak. All of them, they were launching, every single day there was a launch somewhere of a referral hospital. And one would expect rather, these referral hospitals are going to be solid. So in my view, the governors take liability for that. Even for Kakamega, we were told that the Kakamega County governor was the one who was running a very good show in healthcare. Right now, the healthcare workers have given a strike notice. What does that tell you? That even after the devolution of healthcare, the governors have given Kenyans a raw deal. Then the second one comes to Afya House. Some people refer to it as Mafia House. You have got an agency called KEMSA. Instead of procuring equipment and infrastructure necessary to fight COVID, you go there and you buy stuff, not because they've undergone any technical evaluation and the healthcare workers will be happy with it, but simply because you want to create some millionaires and billionaires. A number of healthcare workers have rejected KEMSA supplies, claiming they're substandard. And that's a tragedy, that you can have a medical doctor donning the PPEs, knowing very well that it's safe, while in fact this is sub-quality. And nobody has taken responsibility from KEMSA or even Afya House. But when you look at now our entire approach, I think our approach was largely based on law enforcement. Like when you have a curfew, that is a law enforcement approach to managing COVID. We did not get a solid political approach. We didn't get an anthropological approach. We were shooting in the dark. And the reason why we went for law enforcement, it's the easiest. Ovila has indicated that you need to sanitize, wash your hands, keep social distance, and put on a mask. But some of the masks that doctors have been supplied with are the ones we are told that are of substandard quality. And nobody takes responsibility for that. When you go to the National Assembly, you have the committees responsible for offering leadership, responsible for creating budgets for these. But what do? They cry like the rest of Kenyans, and instead they want choppers. You saw a few weeks ago, Dr. Nikal, highly regarded healthcare worker in Kenya, shedding tears. Those tears add a lot of value if they translate to action to take care of the healthcare workers. But if he just sheds tears and he goes home, he becomes very emotional. You know, the healthcare worker is not going to cover himself or herself using the tears of Dr. Nikal. They want solid PPEs. But on a more positive note, you realize that President Kenyatta a few days ago launched a facility at the Nairobi hospital because he realized that if you allow our international partners like the UN to bring their patients to Kenya, they may compromise our limited capacity. And through a single phone call, you've got a big hospital there which is taking care of UN diplomats and the rest of Kenyans. These are the kind of initiatives you would expect even for the county governors to do. Not for them to just sit there and shed tears and, make everybody believe that they are on the job, while in fact, it's all PR.
Okay. Rosalyn Obala, let's take a keen look on the parliamentary work by the Health Committee. I mean, Dismas hasn't shown away from mentioning how Dr. Nikal was emotional about the plight of his fellow healthcare workers. But, I mean, actions at the end of the day is what matters, and that's what the doctors need, right?
Actually, Jesse, if you remember, Dr. Nikal was former Director Medical Services. So when you see such a leader shed tears, then it tells you to what level the healthcare services has sunk to. And this issue of doctors complaining about the PPEs and the mask and all that did not start today because we didn't have COVID today. Remember, we started the issue of COVID in February. Actually, in March 13th is when we recorded our first case. So I think by now we shouldn't even be talking about the PPEs and how the healthcare workers are protected, or in terms of having the ICU equipments and what is required. I think now what we need to be talking about is how our health facilities are handling the surge in terms of the infections. And this thing we've had over and over. And even when Dismas and Owila talk about the preparation in the counties, remember the counties did not get funds. The allocation for this financial year, they only got for 2 months, that is July and August. We are currently in November. These are counties who have not received allocation for this year. So how do you expect the counties to actually ensure their hospitals are well equipped when they are actually suffering the cash crunch? Now, when it comes to even the healthcare workers, it was so sad last week when we were actually losing, now this time not even losing the healthcare workers, but we were losing the few specialized healthcare officers who give very rare services to Kenyans. Remember, we lost the renal Dr. Molo. We also lost the dental doctor. And this just shows a very worrying trend when we are now seeing our #1 healthcare fighters are the ones that are losing the battle. If you look at that, then where do we leave the common mwananchi? Now, if you look at the Constitution, it says that one of the requirements of our government is to ensure there is adequate health care. Now, both the National Assembly and the Senate have been investigating this issue of health. They started with the graft at KEMSA. They came back to now how to take care of the health workers. And if you look at even that interrogation for that day where the doctor representatives were appearing before the Health Committee of the National Assembly, it was a very emotive process. And when they were taking us through the sufferings that the healthcare workers are going through, it is actually a very sad affair that now the people who are supposed to protect us are the ones who are actually sick. Yeah. Now, somebody like me who sits in the COVID advisory committee of the Lake Region Economic Bloc, that is LREP, some of the issues that we are faced with is that even in terms of advocacy, even in terms of teaching the people, because when you tell the common mwananchi, wear a mask, this person does not have this mask. Where is this person going to get the mask? Because we've not seen the government distributing this mask, yet we know there are loads and loads of masks that are held at KEMSA because of the investigation that are going through.
Right.
And I was so happy when the CS talked about Kagwe saying that those equipments should actually be released to the county. So this is where we are. We are talking about mitigation, yet we have not put the precautions and the required equipments in place to ensure that we fight this pandemic.
All right, now it's definitely a challenge because even in this week, we just had a couple of governors admit that they're paying healthcare workers through bank loans, definitely painting a bad picture of the state of healthcare in the country. Mark Bichachi will definitely come back with your thought. I just ask you to hold on to your thoughts on the status of the COVID-19 recovery plan. We want to take a short break right now, but when we come back, apart from Bichachi's input on the COVID-19 recovery plan, we'll also highlight what's happening in the capital, Nairobi. The governor, Mike Mbuvi Sonko, is a man under siege. We tell you why, this even as Nairobi is set to retain its status as a county. Forget about the spatial status. This is in the BBI. This and much more after the break. Do stay with us.